Hi, my name is Mohini Vavsar, and I work for a social enterprise called Dimagi. Dimagi builds mobile health applications for community health workers. Using ComCare, our open-source mobile platform, community health workers provide women and children with high-quality information and care that they have a right to. Our inspirational idea for women is to build social apps in ComCare for the woman behind the health worker. We will co-design social apps with health workers themselves so that they reflect the lived needs of women and girls in the communities we work in. The apps will be made for personal use, or they could be shared broadly with other community members. Community health workers are change makers in their communities. They serve as critical links to public healthcare services to households in rural, often remote villages. They visit homes of pregnant women and mothers and share important information with them. There's a woman behind the health champion who faces her own set of challenges, has her own dreams and aspirations outside of her job. Community health workers face tough pressures from their families to balance their household priorities along with community service. Somewhere along the slippery balancing act, they forego opportunities to think about themselves and their aspirations. Some of them are activists for women's empowerment but lack training and information to effectively address gender-based issues. Some continue their education, making time to study and learn from home. In an increasingly technology-oriented world, some are keen to learn how to use mobile devices and the internet to have better access to information they need. Information available through mobile phones has been shown to transform the lives of people living in extreme poverty all over the world. However, this potential is limited by a wide array of barriers for women. Women in particular often lack access and awareness to culturally relevant information, as well as the literacy and technical skills to take advantage of this information. There currently is a substantial missed opportunity to address these barriers through the spread of mHealth applications in developing countries. Many mHealth projects, including Dimagi's projects, equip women with mobile phones and train women to use mobile phones for their jobs. This underrated and virtually untapped opportunity offers a powerful platform to provide women with a wide range of information and ultimately bridge the mobile gender gap. We've asked health workers in India and South Africa what they want to learn about. Early prototypes for social apps include a mobile learning tool that contains study modules, quizzes, and score-based incentives, or stories about inspirational women and their accomplishments. We've designed an early prototype of an interactive choose-your-own-adventure story that teaches women about better health practices. Health workers have also suggested that social apps host a set of local and regional recipes. By early 2015, we will build and deploy 15 social apps to over 100 community health workers already using ComCare. During this test period, we will understand what content and app designs are most preferred by women. This will give us insight to curate content and design apps for women better. The Project Inspire grant will allow Dimagi to answer the call to action to bridge the mobile gender gap. We believe social apps have the potential to positively impact women in low-resource settings who use our platform. Dimagi is pushing the envelope for mHealth and exploring social apps as a means to empower women as themselves and the many other forms they play in their lives.